I'd like to welcome you all to the Aging Incubator's Brown Bag. The Aging Incubator is a provost-led initiative that was established for us to be able to facilitate dialogue and activities across the faculty and the broader university environment on issues related to aging. I'm Victoria Ravis, one of 3 co-directors. The other 2 are Babe Wu and Joshua Chodo. We represent several different disciplines, so from top down, the idea of an interdisciplinary approach to being able to address aging is something that we try to infuse throughout all of our activities. So the Brown Bag event is an event in which I'm very delighted to be welcoming Professor Tracy Chippendale, who is an occupational therapist in the School of Steinhardt. And her work is really focused very much on a geriatric population. Her research and teaching assesses and promotes very much aging in place. And as epitomized by that, her presentation today is going to be talking about issues that could potentially adversely impact somebody successfully aging, and that is falls. Tracy will be talking about falls risk and efforts to identify at-risk populations and potentially issues that can be done to mitigate these risks. So without further ado, Professor Chippendale.
Thank you, Vicki, for that nice introduction. So I am an occupational therapist. I've been in the profession for about 25 years. It goes quite fast. So my focus is healthy aging, and that's led me to this work, which is really about outdoor falls prevention. So a little bit of background. Some of this might be review, but hopefully you will pick up a few new pieces of information as we go along. So we know that more than 1 out of every 4 older adults falls each year. So it's a very common issue that faces our growing older adult population. The other thing that we know is outdoor falls are just as common as indoor falls, right? So I think people, when they think of falling, they think over tripping in the bathroom, tripping on a throw rug, which is definitely an issue, but half falls do occur outside. The other thing that's interesting about outdoor falls is they're actually more likely to be caused by an environmental hazard than indoor falls, right? So you think about tripping over a crack in the sidewalk, a pothole, something to do with weather-related influences. So we also know that existing fall prevention programs focus primarily on indoor risk factors. So we have a number of falls prevention programs that have been developed, and that we call them evidence-based in the sense that there's really strong evidence to support that they're effective, which is great. But the focus tends to be more on indoor risk factors. So that's actually what led me to this line of work, is really focusing on a neighborhood environment and outdoor falls. The other thing that's really interesting, actually, is that the risk factors look a little bit different for people who fall inside versus outside. So I think sometimes we tend to sort of put everybody into the same categories, being at risk for falls, but we want to break it apart a little bit and think about it that way. So for example, even though we have a little bit of overlap in risk factors, some things do look different. So for example, people who fall outside, more likely to be fast walkers, right? Not people who walk really slowly, but people who have a fast gait speed, more likely to be male, be in a younger age group, and also have high levels of leisure time physical activity. So we want people to be physically active, and that's a good thing, but it also means you're spending more time outside, specifically people who do sort of vigorous physical activity, so you just have to know that there's risks associated with that. Other things like alcohol consumption, which we know is a risk factor for indoors or outdoors. Other things where there's overlap is things like depressive symptoms or certain types of medication for people at risk as well. So some more background information. Are people familiar with Vision Zero? Vision Zero in New York City is one city that's adopted this. So it's really an international movement. And certain cities have really adopted this approach. And what it is we want to protect the public and bring traffic fatalities and injuries to zero. That's the zero in Vision Zero, right? So it's ambitious, lofty goals, but that's what we want to achieve. And we know also that pedestrians represent the majority of injuries and fatalities when it comes to these traffic accidents. And what's interesting is who's most susceptible. So we know that Currently, approximately 13% of people in New York City are older adults, but they represent a significant percentage of the pedestrian traffic fatalities, and so it's definitely of concern. The New York City Department of Transportation has really been looking into this. What are the issues that seniors face? And some interesting findings, which has informed my work. So things like time to cross the street, right? We have timed pedestrian crossings, and sometimes it's frankly not long enough for people who have a mobility disability, who maybe have a little bit of a slower gait speed. Pedestrian ramps, sometimes we have curb cuts, sometimes we don't. Sometimes that's particularly problematic for people who use a mobility aid. Faded marking, so is that a crosswalk or isn't it? Is the, sometimes the zebra stripes aren't clear, the marking isn't necessarily that obvious. The other one, which we've all faced, is pooling of water. Who hasn't come to the end of the curb and had to either march through a puddle or try to get around it, right? So that's another issue that Department of Transportation has identified. And then also turning vehicles, right? So people get into a lot of trouble, you have a car making a turn, and then people are worried about their safety, and in some cases have an incident as a result. So more background information about community mobility and safety. So one of the things I did sort of earlier on in my work around outdoor falls prevention is I did a survey study, and actually Dr. Ravis was a co-author on the paper that we generated based on the results of this survey. So what I did is I did random digit telephone dialing across the 5 boroughs of New York City. How many people do you think hung up on us? Right? You're randomly selecting people, so it's a bit of a challenge. I had a great team of graduate students working with me to do this telephone survey, and the purpose was this. I wanted it to serve as a needs assessment to figure out what do people know about outdoor falls and what don't they know? What are they already doing? And what maybe are some gaps in terms of strategies that people could use to be safer outside? So it was an interesting survey. In the end, we had a sample of about 120 people across all 5 boroughs of New York. Really interesting. The good people of New York who took the time to answer that survey, I'm always grateful. And the results of that survey were very important in informing the program I'm going to tell you a little bit about today. So what were some of the unmet needs that we identified from the survey? So things like people were not aware of fall risks associated with recreational areas and parking lots, right? So those are some hotspots for outdoor falls, and people weren't generally aware of those as being problematic. Also, stairs are a problem for everybody across the lifespan, right? There's a lot of injuries that occur on stairs. People in midlife fall on stairs, right? And older adults as well. And so people just didn't have that awareness that treat stairs very carefully, right? Because there's a lot of injuries that occur there. Also, things that people weren't maybe were a little bit less familiar with, also the influence of multifocal lenses. So for example, I wear progressive lenses, right? So that means I'm looking at distance when I look straight out, and the bottom portion of my glasses is for reading. What happens when you go up and down a curve if you're looking through the reading portion of your glasses, right? So a lot of people weren't aware of sort of the dangers associated with multifocal lenses. Other things we uncovered, some issues around safe walking strategies that people weren't using. So for example, people were not avoiding distractions, right? They were talking on their cell phones, they're texting, they're actually walking sometimes very fast and in areas that are problematic. So sometimes it was people's own behavior that we could see that more sort of education needed to be done. The other issue that people faced is how to carry items safely, whether that's your groceries or your laundry, whatever that you're carrying, on both level as well as uneven surfaces. So that was another thing we identified from the survey that needed to be addressed. Other things like safety, opening and closing heavy doors, right? Because that can be a risk for some people. As well as not just knowing that stairs are a problem, but how do you safely go up and down stairs, especially if you have maybe a joint problem or some pain on one side of your body. And the last thing we identified from the survey is that people weren't advocating for themselves, right? So they might have been seeing environmental problems in the city, but people didn't do anything about it, right? Nobody was advocating for change. So that was sort of some of the things that we uncovered in that survey. So that was one of the kind of earlier works I did to kind of figure out, what do people know and don't know? What do we need to, if we're going to develop a new program, what should be included? So that led me to Stroll Safe. So Stroll Safe is the name of the program I developed that really focuses on outdoor falls prevention. So how I developed the program is I took the survey study and the results of that. Also existing research that epidemiologists had done and what are the risks for outdoor falls, and then also what we know for common locations of outdoor falls. So sort of pulling that all together, I developed sort of preliminary program with modules that really focused on safety in the neighborhood. So I informed that program by a couple of models. One is the ecological model, right? So those of us not in public health in the room or in health sciences, these are kind of ways that we can inform programs and inform what we do. And so basically health belief, so we'll start with the sort of ecological model, is really this idea that you have to address the issue on many levels. So interpersonal factors would be, what do people already know and what are their beliefs about outdoor falls? So that needed to be addressed in the program. Also interpersonal factors, so peers, because people can learn a lot from people their own age who live in their own neighborhood, right? And then also at the community level, a neighborhood feature. So it's not enough to change things about ourselves, we also want to think about the influence of the neighborhood environment. And then the health belief model is, we want to understand that people know that they're susceptible to a concern, so who's at risk for outdoor falls, they understand the severity if an incident does occur, but they understand that there are benefits to learning new information and trying new strategies, to think a little bit about barriers as well as cues to action. So all those things informed how I developed the program in terms of things like, it's not enough to just teach people information and share knowledge, they need the opportunity to practice those skills, right? So those are the kind of things that I embedded into the program. So Stroll Safe, that's the name of the program, as I've mentioned. What does it look like? So basically, it's a program that meets once a week for 7 weeks. And every time we meet for about an hour and a half. So it's group-based, 12 to 13 people attend a given site session. And basically what it is, I initially created a manual, so every week we cover certain topics. And I refined that manual based on a feasibility study, which I'll tell you about in a few minutes. So who's eligible? Who did I sort of sign on to participate? So people who are 60 and over, who live in the community, as opposed to somebody who lives in some sort of supported housing. Also people who are independent in community mobility. So some people could use a mobility aid like a cane or a walker or nothing at all, but the idea is sometimes people don't go out alone, they only go out with somebody sort of standing right next to them. And so in that case, they're not somebody necessarily who's gonna get much out of the program if they always had close supervision. The other criteria was people have to answer yes to one or more of the following. So either they have a fear of falling, so sometimes people have not fallen, but they still have this concern that they could fall, right? So that's one of the criteria. Or people who've stumbled or tripped 2 or more times in the last month. So sometimes people don't actually fall and hit the ground, but they might be out walking around and frequently have a stumble or a trip and rebalance themselves. We know from not my work, but from the work of somebody else, that actually is makes people more at risk for a subsequent fall. So we looked at that. So either fear of falling, 2 or more stumbles or trips in the last month, or a fall in the last year with an injury, or 2 falls in the last year without an injury. So those were sort of the criteria I included to engage people who might be interested in participating in the program. So what does the program look like? Again, it's group-based. It's led by an occupational therapist. So far, I've been the only group leader, and I've run the program in a lot of sites, which I'll tell you about. But also, I bring knowledge as an occupational therapist, but when you bring people together with a lot of life experience and knowledge, they can learn from each other, right? So if somebody's 60 or over, they have a lot of life experience to draw on, and they bring that to the group as well. So that's really important, is the group discussion and problem solving. Also, when we come up with good strategies based on each of our modules, we make note of them. So we either keep a whiteboard or keep detailed notes so that that information then gets transcribed and given to people as handouts. So we come up with these great ideas, and then sometimes we almost say in one ear, out the other, but being able to create a handout that people can take away is just another way to help sort of facilitate the changes. We also do action planning. So I always say to the people who participate in my groups that what we know and what we do are sometimes 2 different things, right? We know we shouldn't run to catch the bus, right? But it doesn't mean that people don't do it, right? So it's this idea that during the group sessions, people come up with at least 1 or 2 or 3 things that they're going to do the following week to be safer outside. So we talk about it, we discuss it, We also put action plans into place. The other thing we do is, in addition to sort of bringing some knowledge from the OT world, I also do some demonstrations. So my joke is when people sign on to participate in the group, I said, my job is to entertain you. So we make it fun, we make the group enjoyable. I show people how to fall safely, how to get up after a fall. I run around New York City with my therapy mat to all these different sites around New York so that I can show you how to safely fall and get up. So that's part of the group as well. So we have group discussion, we have knowledge sharing. The other interesting thing is, as I said, we want to make sure people can then enact some of these strategies. So part of what we do is we actually, of the 7 sessions, 2 times we actually go outside. In one of those sessions, I coach people on some of the strategies to be safer. And then we also do a neighborhood audit, which I'll go into more detail in a minute. It's a tool that was developed by a colleague in Vancouver that allows us to look street segment by street segment at hazards in the neighborhood, and to use that both as a tool to plan where we're going to walk, but also for advocacy. So that's a little bit about the program. It's a little bit of an overview. And I want to just go into just a little bit more detail about what happens each week of the 7-week program. So first week, module 1, is we talk about the built environment. So that's everything from safely navigating curbs to parking lots, to going up and down stairs safely, and also bricks and cobblestones. So we have those here in Manhattan, and they can be real challenging for people. In other boroughs, it's less of an issue. So things would be, I would talk about what's the risks, what's the incidence of falls in each of these locations, what's some strategies to safely go up and down a curb and some stairs. So I do some demonstrations, which we later practice in a subsequent session. We also talk a little bit about safely navigating public transportation. So navigating the bus, getting on and off safely. So that's part of it as well. We do that group discussion and problem solving, because what I'm finding is I'm offering the program in a lot of different neighborhoods, and every neighborhood has its own challenges. So I think that's important that we think about public transit, or is there something else going on in that neighborhood, and so that sort of individual sort of group discussion helps some of those problems surface, and then we come up with some innovative solutions as a group. So the next week, after we talk about some of the sort of called built environment kind of hazards, we talk a little bit about the social environment, right? So I remember I did a study right after City Bike was introduced, and seniors were in a panic because people were getting on those city bikes, going one way, the wrong way down the street. People said, I don't worry about the cars, I worry about the bicycles, right? And so when I did that qualitative study early on, it really sort of brought to light some of the issues people face, not just about potholes and uneven surfaces, but also the behavior of other people, right? So whether that's somebody on a bicycle, other pedestrians. Have you ever been around a school when they let out? What happens? They rush, right? And so, believe me, if you have a little bit of a balance impairment, that is the accident waiting to happen, right? To be out on the street when they let schools out and dealing with those challenges. So that's definitely an important topic, the social environment. What can we do if there's heavy pedestrian traffic? What can we do to be safer in environments where we have a lot of sort of multiple sources of traffic? So that's part of what we do in Module 2. Just to give you a couple examples of what that might look like. So we talk about, there's one thing I teach we call standing your ground. So sometimes I've had patients who've come to me for rehabilitation, and the reason they fell is they were trying to get out of the way of somebody and lost their own balance and fell. So this idea that you stand and you wait for people to go around you, you're probably better off, especially if you have a balance impairment. The other one we teach people is just plan your route and think about your travel time, because there's certain hot times where if you live in a school district, you don't want to be out on the sidewalk, right? You either want to take a different route or avoid that area at that time. So those are just a couple of examples. And then week 3, we actually go outside. So we kind of pull together what we've learned and some of the strategies we've been talking about opening and closing doors or going up and down curbs or safe strategies for stairs. And then we actually go outside and practice some of those strategies in week 3. So it's sort of supervised practice and coaching for those strategies. And then Module 3, it talks about neighborhood conditions. So things like, if you have an area where there's poor street sidewalk conditions, whether they're uneven surfaces or sometimes we have paving stones that look like this, I don't know if anybody's walked through here, but between Box Library and I think it's Stern, there's paving stones, right? And sometimes they're a little bit uneven. We talk about strategies around clearing your feet and making sure you can navigate that safely. Also things like, so not just poor conditions around pavement, but also things related to weather, and being able to do things safely in bad weather. You know, what are some strategies we can use? One thing I just wanted to bring up, because I think it applies to a lot of people. People heard of yak tracks? Yes. Some people have. So the only thing is they're limited because you cannot put them on inside. If you put them on in your apartment or on an indoor space, they're very slippery. But if some people live in an apartment and have a bench right outside, and if you can put them on and take them off when you're outdoors, it actually does give you more traction, and there's some research evidence to support that it does prevent you from slipping on icy surfaces. So that's one thing, for example, that we talk about around bad weather. Anything else I was going to mention there? So a little bit about, other strategies. I like this one. So if you're in an environment where there's lots of potholes, uneven surfaces, there's a strategy I like to teach called walk now, talk later. Because as we get older, sometimes divided attention becomes more challenging to us. So if you're having this really deep conversation with somebody while you're walking outside, you're probably not paying attention to what's on the sidewalk, right? So the idea is you're out there walking for fitness, good, walk now, and then if you're with a friend, sit on a bench, sit in a coffee shop and talk later so that you're not going to distract each other. The joke is I used to tell my friends and family, you know, when they trip on the sidewalk, I'm like, be careful, and I get a lot of eye rolling because it's too much too late. The person's already tripped, right? And they're like, oh. So now when I walk with friends and family, I basically say, watch that, be careful of that. So you're talking to them, but you're doing it in a more productive way. You're not just distracting them from the environment, but you're actually pointing out hazards before the person hits them, right? So that's one of the strategies we talk about as well in the group. So that's a little bit about neighborhood conditions. And then week 5, we cover personal factors. So things like overdoing it. And then things like walking too fast, or also we talk a little bit about, even though it's not an exercise-based program, one of the discussions we have is, what do we know, what does research support in terms of the type of exercise that benefits people for falls prevention, and then what's available in your neighborhood? Like what's low or no cost exercise programs that are going to be beneficial to you, that are going to reduce your risk of falls. So that's part of the conversation as well. And of course, action planning related to that. What am I going to do differently this week to be safer? I want to mention something just briefly about overexertion, because that's an important topic in my program as well. And this came from a qualitative study I did, again, sort of in Lower Manhattan. And somebody told me, you know what, I read an article in the New York Times about how important it was for seniors to be physically active and walk. So she walked and walked and walked, made herself physically exhausted, and then tripped and had an injury. Right? So this idea that it's good to be physically active, but when you overdo it, that becomes a risk. And so that was also something we start talking about in the Stroll Safe program. I'm going to go into a little bit more detail about the SWAN neighborhood audit tool in a minute. That's what we do week 6. And then week 7 is more of a summary session about what did we learn, how can we now take these strategies and ensure that we're using them more consistently and that we sustain some of the changes that we've made. I also get feedback. So there's a term in healthcare we call CQI, continuous quality improvement. So we can always make things better, right? So I always love to get feedback from people about what they liked, what they'd like to see more of, and that becomes part of the program as well. So I want to talk just a little bit about the SWAN, Stakeholders Walkability Audit in the Neighborhood. So this is a tool that was developed by a colleague of mine, Atiya Mahmood, who's at Simon Fraser University in Vancouver, Canada. And she collaborated with some researchers in Germany to develop this tool, which is systematically their own neighborhood to see where are their problems, so then they can use that as to develop strategies to be safer in their neighborhood, but also as an advocacy tool to say that, okay, I've done this audit and these are the hot spots in my neighborhood. We need to get the community boards in New York on board. We need to report this to the city. So it evaluates basically features that affect mobility of older adults and those using mobility devices. And it looks at everything from the function of street crossings to safety of streets, in terms of including traffic patterns, and then also personal safety. So one of the things I like about this tool, so it looks at things like lighting, curb cuts, marked crossings, all the things we know are important for safe community mobility, seasonal obstacles, because sometimes in the fall you have wet leaves, right, that you don't necessarily have at other times of the year, so that's part of the audit. And then in addition to the behavior of cyclists, she includes something about dog walkers. So I find that really interesting because maybe it's a problem in Vancouver too, where they developed the tool, but it's certainly a problem here. And in the groups that I run, people say that people have their dog on a long leash. I had one senior who participated in my program in Brooklyn last semester, and she said somebody was like on their phone, not paying attention, and their dog literally wound its leash around her legs while she's standing there, right? So again, sort of that's part of the audit, is looking at those kind of, not just what's happening in the sort of the built environment, but what's happening in the social environment as well. So that's a great tool. It's part of the Stroll Safe program now, so we do these audits and we send out seniors and pairs to kind of look at street segments more strategically. So this is, I find this really exciting. I'm collaborating with some people at Tandem on data visualization. So we call it big data. So we have all this data that we can use to inform healthcare, inform, in this case, outdoor falls prevention. So there's a team of people that are associated with visualization, imaging, and data analysis here at NYU. So it's a center where this is sort of the emphasis of what they study. And they've done a number of things. Some of them are useful to me. So one of the things they did is they designed an interactive map of shade across all of New York City. So why do you think that matters to people? Forget about falls and outdoor falls and safety. Why do you think people would want to know how much shade is in a neighborhood? Any thoughts? No thoughts? Why do people care that it's, let's say in the wintertime and they go by seasons, that whole street and neighborhood, or that, let's say that whole street segment is under shade most of the day in the winter?
So the snow's not going to melt.
That's my interest. You're right. And we'll talk about that, about black ice and when black ice forms. But they had different ideas. So for them, it's about real estate. So think about it. If you're going to buy a condo in New York and spend all of that money, right? You want to make sure that you're not going to be under a cover of shade most of the day. So that's the original purpose of the map. But we do know that black ice forms under certain conditions, right? 32 degrees. It's either raining or sleeting. It's usually early morning or late at night, right? And it's in areas that don't get sunlight, right? So the areas where it's going to get very little sunlight during the day. So then we can use that map to identify hot spots for black ice, right? So that's one of the tools that they have delivered and that are useful. So when I'm working with people in their neighborhood around safety, we can say, okay, here's a map of your neighborhood, and these are the streets that are going to have hot spots for black ice in the winter, because these are the streets that aren't getting sun for most of the day. So it's interesting what they do. You can read the description. I'm not a meteorologist and I'm not an engineer, but thankfully I have people who are. And so what they do is they have accurate 3D buildings that enable them to compute exactly how much shadow is accumulated in any selected period of time. So again, they should go by seasons. And then they calculate a net shadow score, which is the percentage of time per day that place is going to be in shadow. And so as I mentioned, my purposes are to help identify black ice. And another interesting thing that they're working on now is a tool where, believe it or not, they have somebody who drives around taking pictures of every street all over New York City, and they're using that data to figure out, to generate interactive maps of areas that in inclement weather, so on a very rainy or snowy day, these are the areas that are going to be most problematic because they're not getting cleared or there's pooling of water. So that's another map that they're currently working on. But we can use that information to help people make good decisions about where to walk and how to be safer. So a little bit about my feasibility study. I just want to say that where this work is at. So I've run this program many times. I'm about halfway through a 2-year program where I'm offering it in 8 community sites around New York City. But it all started with a feasibility study. And so the idea was that here's the modules, here's the program I've developed. Things need to be tweaked before we offer it on a larger scale. So I completed that. I did everything from take attendance records to kept a reflective log to see what's going well, what could be changed to be better. Having a fidelity checklist, so what that means is that we audio recorded the first time around. I audio recorded every program session, and then we listened back to say, hey, are we covering the things we need to cover that are included in the manual? And then Also, I looked at preliminary outcomes. So the first time I ran it was a small group of individuals. So we were just looking to see overall, are people, after the program, are they using more strategies, right? Are doing things safer? Are they stumbling, tripping, and slipping any less than they were before? And we recorded that information on calendars and sort of followed people over time. So initially I had 24 people, so 12 were in the group and 12 people just received some written information, a brochure on some tips, and so that was sort of how I got started to start looking at the program. And I got some great feedback about how to make the program stronger before we sort of bring it on a larger scale. And so we say that we do a process, resource, and management assessments. It's not enough just to say, okay, good, people are using more strategies, but the idea behind running the program the first time was like, what's working? What can we change to make the program stronger? So I relied heavily on those first 12 participants to give me some really good feedback, honest feedback, but what they liked about the program and things that could be done differently. So what I discovered, which was really important, was how many OTs you need per number of participants, especially if you're taking people outside to show them to do things safer and coaching them. So that was really important to figure that out. Also, I thought was really interesting is, it actually is a good thing in some ways, not a good thing for research, but a good thing for in terms of impact, is that there's contamination. So what that means is that if you have some people who would be assigned to a control group, which means you're going to get the program later, and some people are assigned to the initial group that goes first, people talk to each other. So people would say, oh, the strategies you taught me, I've been showing my neighbor, I tell her not like that, so people are kind of spreading the word when they learn the strategies, which is good, but for my case, it helped me design my study so that that doesn't happen in the context of research. So, but it was good. So people, once they learn things, they share it, spread the message, but we have to just make sure then that people in the next sort of study don't have that opportunity to talk to each other. So that's how I helped me design my study. Some other topics, so people in the group were great giving me feedback, and the type of things they wanted more information on, which I've since added to the more current version of the program, more information on wind. Depending on where you live in the city, there's like horrendous wind tunnels, and that becomes an issue around safe mobility. Greater focus on use of mobility aids. So I was doing a lot of focus on using your mobility aid to go up and down stairs, but people were saying, forget up and down stairs, I don't even know how to use it properly on a level surface. And it's not just my work that showed this, there's actually a body of evidence now to show that a lot of people have a mobility aid. It could be a cane, could be a walker, and they're not entirely sure how to use it safely. And so that became part of the program as well. And then also more of a focus on strategies for safe use of public transit. So thanks to their feedback, I sort of enhanced some of those areas of the program. The initial results look good in the sense that the overall trend was a decrease in the number of trips, slips, and stumbles for both people who got the written information as well as those who participated in the program. But those who came to the program for 7 weeks had better outcomes. So then the question is, what am I doing next with this, right? So I have this program, 7-week program, and as I mentioned, I'm about halfway through an efficacy trial. So what that means is that once you do a small little study to kind of iron out the details, then you're kind of looking at it on a larger scale at how the program might benefit people. So I'm partnering with 8 different community sites across New York City. Have people heard of NORCs? Yeah, so naturally occurring retirement communities, right? So they're places where people aged in place. They might have moved in their 20s, their 30s, their 40s, and they're still there in their 60s, 70s, and 80s. And so they're neighborhoods where we have large concentrations of older adults. And often what it is the services kind of spring up around them. So I think it's a great philosophy, it's a great model of care. I'm really excited about what they do. I share their beliefs in terms of keeping people at home and helping them age in place. I think it's a great initiative. So I've partnered with 8 different community sites, which are part of a larger organization. And so it's a 2-year project, and like I said, I'm just over halfway through. And so far the results look good. Continuing to recruit right now, but it's still in the works to see really if there's enough evidence to support the program and future use in other community sites. So my goals are, if it looks good and the results are positive in terms of having significant benefits for the people who participate, my next step would be to train other occupational therapists in how to run the program. So that would be sort of next steps. And then there's also, so for people who are researchers, there's resources available for evidence-based falls prevention programs to translate those programs on a larger scale. And that's just one entity, the ACL, the Administration for Community Living, that helps support those types of programs and actually has money available to be able to offer programs on a larger scale. And then also, of course, New York City, we have people who don't speak English, right? And so the idea is it would be wonderful in the future to create programs that are culturally and linguistically sensitive for people who maybe speak Spanish, for people who speak Russian. I'm counting a lot of Russian speakers. I'm in Coney Island right now. And so being able to offer the program to people in other languages and make sure it's not just, like I said, the right language, but that the materials make sense to people from different cultural groups. So I think that's all I wanted to say. One more thing I can show you. This is the logo for the program. Everything we give people has my logo. Stroll Safe, it's a little sneaker, and a few references about outdoor falls. From my own work and the work of other people as well. So, any questions? Yeah.
What are NORCs?
Naturally occurring retirement communities. You know what the first one is in this, I think ever, in the US? Penn South. So you know Penn South? It's on the west side of Manhattan, like in the 20s, I think, 26, 27, 28. So what it is that they have a large population of people who've aged in place. You have a lot of teachers, a lot of people who just lived there their whole lives, and now you have a large percentage of people 65 and older living in that community. So that's just one example, Penn South. There's others around the city as well. But yeah, it's great because what they do is they offer services to people in their communities. So for example, they have a social worker on staff. Sometimes they bring in visiting nurse to do sort of health related programming. They have a lot of health and wellness exercise programs offered through those networks of services.
You're right. Thanks.
Is your Stroll Safe program based on your lifestyle design model?
Oh, good question. Thanks for that, Meredith. Meredith is an OT student. So that's great. So what it is, so this idea that OT is expert, but who also draws from the expertise of the group member, who jots down notes in terms of keeping track of that as a handout, action planning, practice. That's all very consistent with Lifestyle Redesign, which is a program that was developed at USC that's sort of health and wellness focused for people, seniors who live in the community. So same sort of model in terms of how the program's executed. Yeah. Great. Anybody else? Yeah.
Are the manuals available online for those of us who can't participate?
No, because the manual, what is it? It's a training manual for occupational therapists to lead the program. So it's not just, here's some information, go to it.
Maybe I mean the handouts.
So the handouts I don't yet have available, and I think that might be a nice resource, I think, to think about. So right now, I'm in the middle of the study, so I don't necessarily want to make sure everybody has access to that, but I think down the road, you're right, there's some people who could come and attend a 7-week program. For people who can't, having a little bit of written information would be a nice resource. So I hope to do that in the future. Yeah. Anybody else? Yeah.
Do you guys do any physical exercises, strengthening or balance kind of exercises, or is it really mostly patient education?
Yeah, so that's a great question. So the program, one of the weeks we discuss, we don't actually do exercise in the group except to go outside and practice some of the strategies. But what we do is we have, part of our discussion is focused on what's evidence-based or what's supported by research in terms of exercises that do help improve your balance, that reduce your risk of falls. So we talk about that, and then we make it individual to the neighborhood, because different neighborhoods to have different resources in terms of low or no cost exercise programs. So we talk about, okay, what do we have here that you could do, that you can participate on regularly that will help reduce your risk. Because even though we don't physically do exercises in the group, that's certainly part of what we discuss.
Okay.
Yeah, great. What else? Yeah.
In terms of the outcomes that you're measuring, I could see one important outcome would be if people joined this because they were uncomfortable walking outside.
Yeah.
So do you measure an increased amount of time spent outdoors,
Yeah.
or activities that they're doing?
So part of what we look at in outcomes is, one of the outcomes we're looking at is concern about outdoor falls. So that's one of the outcomes we're looking at. The other one is we do ask people sort of the amount of physical activity that they do, how often, what type of physical activity. So that's something we're tracking over time as well. So, yeah. Anything else? Yeah.
I was just wondering, I know they're all different departments too, improve all the things that are causing these. I mean, like you mentioned, the one about traffic lights that are too
Right.
short. I mean, I can think of quite a few that I pass. There's one where the sun is in your eye and you can't even see the stop light, and you can't see when it says to go. I mean, you have to look at traffic to know how to cross the street. So are there any connections to these?
Yeah, so I'll tell you two things. One is Department for Transportation, New York City Department, they're looking at all this. They have there's a lot going on right now in New York called age-friendly cities, and in fact, we had a wonderful presentation last semester given by Joe Ivy Beaufort about the age-friendly cities. So there's a big emphasis right now on sort of getting people's feedback about what the issues are and trying to make changes. So I'll say that. Department of Transportation is working on it, and in my program, what we do is, if that was an issue for a lot of people, we'd come up in discussion and we'd come up with, as a group, some strategies to be able to manage some of those hazards. So I think it is being addressed on many levels. Yeah.
With New York City, it's like constant construction, things are building, changes in the streets and so on. Are there thoughts around like the impact of that, or like how do someone adjust to these changes?
Yeah, that's a great question. So I think in our group, for example, in the program,
She said, I didn't quite catch.
oh, she asked about, there's so much construction going on in the city, and it's really interferes with a lot of people's sort of lives and mobility. So what are we doing about that? So, for example, in Stroll Safe, what we do is we think about route planning. So if we know certain areas are really hot spots for construction and being sort of unsafe or difficult places to maneuver, we think about route planning to be able to manage that safer. Also, if there's something that's really causing a problem, I always encourage people to self-advocate. So what that means is, if this is an issue, you report it to the city, right? And again, it doesn't necessarily mean they're immediately going to change it, but I have some really good success stories. I can just tell you of somebody who lived in Sheepshead Bay who participated in my feasibility study. Very active, physically active woman in her late 60s, tennis player, really active, but where she lived, there was a massive pothole outside of her apartment. So, I showed her the way you can go online to report those problems, and she'd come back every week and say, nothing yet, no changes. And then I get a call maybe 2 or 3 months after the program ended. She's like, Tracy, you're never going to believe it, they fixed it. So I think we do have success stories about people reporting problems and having the changes made. And then it's not just good for that individual, it's beneficial to everybody, right? So I think it's good to advocate as well as change your own behavior to be safer. So
Yeah, I can kind of follow up on that, because I did exactly that, because the tenants in my building were never informed about the entire block being blockaded. We're talking about the Little Red Schoolhouse.
Oh yeah.
And we're doing like a new park there, and so I called the district office, and various things, there were problems, the fact that safety issues and whatever, but it is helpful because there is response.
Yeah.
And sometimes people are reluctant to do it, but somebody has to do
I
it,
agree.
and it does nudge them.
Yeah.
I always I tell my husband, I said, if it ever gets done, it's because I called them up to help. Another thing I just wanted to bring up, a question that I had that you didn't, I don't know if you mentioned it, but the social aspect of like walking along with family members, or like other people who you're walking with who might be faster, or they don't really accept, or you don't want to admit that you have trouble walking. It's kind of like keeping that whole social issue about the walkability, and people keep quiet about it because they don't want to let them know, or they're embarrassed that they're walking slower.
I think you're right. I think the thing I did mention was just about distracting people, especially people with a mobility disability. The last thing you want to do is keep distracting and talking to them while they're trying to navigate a very busy environment with lots of environmental hazards. So I always encourage people, you know what, let's talk more about that later. Let's walk now and get there safely. But also you brought up something very interesting. I just interviewed a woman this morning for my study, and she was mentioning that she walks fast, and that when her friends walk with her, they're like, whoa, slow down. So she's had to learn she's a very active, agile 85-year-old, and so the idea is that she's had to slow her pace, which is not a bad thing for her, but also for the people that she's walking with, so that we don't put other people at risk for trying to keep up. So I think that's a good point.
And also, sometimes like with my husband, sometimes we'll want to cross the street and go faster because the lights changing. And there's a difference in the way we see walking across the street, or the things that we have problems with. So there's like a kind of like
but help each other out. So wait till you have the full light, right? So that you don't get stuck halfway. And if you see something, say just be careful, watch that so that you're at least, being sort of productive and alerting to somebody who may not see that hazard. That would be my 2 cents. Thank you. Great, I think that's it. Yeah, thank you for coming.
And I want to thank Tracy for her very provocative and public health oriented presentation, and you're fighting a good fight.
Thank you.
Thank you. Thank you all for